Diabetes, one of the very common lifestyle endocrine health problem. Lot of people have a diabetes, and we all of us know that the management of the diabetes is a very important. If you keep your blood sugars in the target range, you increase your longevity as well as reduces the chances of complication which can happen due to diabetes. And when we talk about the management of the diabetes, many different class of medications are available. And as medical science advances, we do get newer and newer medication to help manage diabetes in a better way and to reduce the complications which can happen due to the same. One such and a very recent advancement medication which is available in our country, and that is a GLP-1 receptor agonist, okay, which is known as a very commonly medication like a Rybelsus. Now this Rybelsus contains a medication called as a semaglutide. Now the semaglutide is available in the tablet form in India. And once a person starts taking semaglutide, they do develop a certain side effects. And one of the most common side effect is the nausea and vomiting. Whether you want or you don't want, you do get these problems. And when you get these problems, it discourages a person to continue with the medication. And many times a patient comes and asks to the doctor, what can we do to reduce this side effect? Well, today's video is based on the same point. I'm going to help you in understanding certain tips and tricks which if you include, you will be able to reduce the side effects like nausea and vomiting which can happen with the Rybelsus. How they are implemented, that's what we will learn today. Namaste. My name is Dr. Tanvi Mayur Patel. I'm an endocrinologist, hormone specialist doctor from Mumbai, India. Diabetes, very common health problem, and the treatment management is very advanced nowadays. And that's where the Rybelsus comes into picture. Rybelsus is an oral version of a semaglutide, which is a GLP-1 receptor agonist. Invariably, lot of people get a nausea and a vomiting, and this is really a concern and bothering to them. What to do about it? So understand, a person develops these side effects in two common ways. The first way is when this medicine is introduced for the very first time. Yes, you are suddenly started taking medication and your body is not used to that, you develop a problem. And the second situation is wherein the dose is up titrated. Means you were taking 3 milligram before, now the doctor has moved you to let's say 7 milligram or 14 milligram. And then because of the up titration of the dosage, you develop this problem. These are the two common places where a person develops the side effects. So what to do about it? So first and foremost is a titration. Yes, the titration has to be very gradual. Now I understand now this titration of the medication is not in your hand. It is decided by your treating doctor. But of course your treating doctor also has this point in mind. But as a patient and as a person who, if you are going to consume, you must also keep this point in mind that the dosage has to be up titrated slowly. So what happens when you have never taken this medicine? We always advise you with the smallest dosage, that's a 3 milligram. Let your body get adjusted to this smaller dose for at least a month. And after that, gradually when you up titrate, you will find that your body has plenty of time to adjust to the new medication, and that will reduce your chance of nausea and vomiting. This is the first point. Second, now nausea and vomiting has a lot to do with the kind of a food you interact with. And that's where a lifestyle plays into an important role. I will tell you certain tips and tricks which will help you. So first of all, when it comes to food, when are you going to eat food? So first, whenever you feel hungry, you are going to eat your food. Yes. See what happens when you take a GLP-1, okay? These medication reduces your hunger. So suddenly, let's say you were eating 3 times a day and you were getting a hunger, let's say for a roti, 2. You were able to eat 2 rotis 3 times a day. Let's say this was your hunger before. Once you start taking this medication, you will feel that your hunger has come down. Your need of the food has also come down. So what is important? You are going to eat food only when you feel hungry. Very important. Usually what happens, once a doctor has given this new medicine, a patient still have a thought in my mind that I have to eat 3 to 4 times a day and I have to eat this much amount of food. When you have these preconceived notions, okay, if you eat, even though you are not feeling hungry, you tend to develop the nausea, vomiting more. Okay, so first and foremost, you have to eat only when you feel hungry. But also this also depends what kind of other medications you are taking. If you are taking insulin or if you are taking any medicine which has a potency to reduce your blood sugar and to give you a low blood sugar, then in that case you need to discuss this point with your treating doctor. Because lot of times if you take this medicine along with the insulin or hypoglycemic medication, you will find that you will end up in a hypoglycemia if you skip your meal. So please speak with your treating doctor and adjust all your medications accordingly. Okay, but let's assume that you are not taking insulin or any hypoglycemic medicine, then in that case you have to eat food only when you feel hungry. Second, how much to eat? Again, it depends on your hunger. Since your appetite has come down, your quantity of the food consumption is also going to be reduced. Let's say you were able to eat 2 or 3 rotis before, suddenly you find that your appetite has come down. And if you listen to your body and if you eat it accordingly, you will be able to save yourself from nausea, vomiting. But if you keep on eating in the opposed to your body's indication, you tend to develop nausea, vomiting. So you need to keep this point in mind. Third point, where are you going to eat food? Whether it will be home cooked food or outside food. When you have a home cooked food, your chances of nausea, vomiting is much lesser. The reason behind it, home cooked food is a more lighter, okay, unless and if you have it a restaurant or outside food which is made up of more oil, more fat, and it has more spices, which can be little difficult. Sometimes if it is a processed food, again it is difficult. So home cooked food is the best answer. Okay, when you are eating food, you have to ensure that you chew your food properly. If you don't chew your food properly, nausea, vomiting increases. So please chew your food properly. When you are eating food, be a little bit more mindful about it, about what you are eating, how much you are eating. Avoid any kind of distractions like watching television or maybe, mobile phone. Keep such distractions away. Okay. Next, avoid doing any kind of physical activity after the eating. Okay, very important. Lot of times, lot of people after having a meal, they have a brisk walk. It is found that if you suddenly develop some kind of a physical activity, nausea, vomiting increases. So you can avoid such kind of a activity immediately after eating. Yes, after some time you can definitely do that, but this you need to keep in mind. Another thing is that many people have a habit of lying down after taking the medicine. Try to avoid that, because when you lie down, okay, the body position changes, and many times people find that the food is regurgitating up, and that gives a nausea, vomiting impact. So avoid lying down after eating a meal. Okay, these are the certain tips and tricks. Now when you are eating food, what kind of food you should eat? You should eat food which is either steamed, grilled, or oven cooked. Okay, avoid food like a greasy, oily, fried food. Avoid too spicy, too sugary, processed food, avoid alcohol. All of this will have an impact. When you are having liquids, okay, again try to have a liquid like a more in the liquid form like a soups, okay. Avoid fruit juices or avoid any kind of a sugary drinks, avoid alcohol. Again, avoid using a straw when you are drinking a liquid. Again, this will help you reducing your nausea and vomiting. If at all you develop a vomiting, then in that case speak with your doctor, ensure that you work on your hydration, you are very adequately hydrated well. Secondly, include lot of soups in your diet if you have a vomiting, because this will further aggravate your kidney issues. So please speak with your doctor and be mindful about it. Okay, all these tips and tricks if you do, you will be able to save yourself from nausea and vomiting. Some people find it very useful when they develop such kind of an impact. They put a small piece of a ginger or a lemon in their mouth, and this also helps them reduce their nausea and vomiting. Okay, I hope this helps, and please in the comment box write which tip has helped you the most. Probably one of the tips which I told you in the video, or if you have taken this medicine and what tip you did for yourself which helped you, you can write that in the comment box so other viewer can read that and can also implement it in their life. I hope this video helped you in understanding about your health a little more better way. And if you like the video, please click on the like button. If you are new to my channel, don't forget to subscribe. The subscription gives me encouragement to make such more useful videos. And if you have any of your personal question whose answer you are seeking for, write that in the comment box below. I try to read and answer them as early as I can. Alright, we will meet again. Till then, you take care of yourself. Namaste.